Transcarotid Artery Revascularization, we're going to talk about here for just a moment, or TCAR. That is a less invasive procedure than standard open carotid surgery. It's still invasive, but the device that's involved is a newer device. The concept of carotid angioplasty and stenting has been around since the early to mid 1990s. This device has changed it, which really came around in 2015 and 2016, and we were one of the first groups to really start using it and participating in some of the inpatient trials. It involves a small incision just above the clavicle where we gain access to the carotid artery. We place a special sheath that goes inside the carotid artery and then another sheath that goes in the femoral vein. There's a tube that gets hooked together and there's a trap in between the tube that reverses the flow. And so when we're trying to place a wire across the blockage or blow up the balloon, if anything breaks off, it doesn't go up into the brain, which is what causes strokes in carotid surgery in general. It comes down and it gets caught into the trap. Once the stent has been deployed, we restore flow, and when we prove that everything looks great, the sheath comes out in both areas and the patients go to the recovery room. The patient stay time is basically equivalent. It's usually overnight in 99% of patients. And the outcomes are equal to open carotid surgery, so it's something that we do routinely here at Sarasota Vascular Specialists.